watching Eyewitness News in high definition.
What do mammograms, blood sugar tests, and daytime dosing have in common? All may offer clues that someone is headed for a stroke.
Eyewitness News reporter Giovanna Lara joins us now to explain why some doctors think these clues could be life-saving.
Heart disease is the #1 leading cause of death in this country, with stroke following not far behind as the 3rd leading killer of Americans. Now, studies suggest doctors can find new, earlier clues that a patient may be at risk long before they develop the telltale signs of heart disease and stroke.
How you doing?
Hi there.
How things going?
Great.
How's your blood pressure doing?
It's fine.
Marge Mason was just 45 years old when she suffered a heart attack, surprising her doctor, family, and friends, who all agreed the slender, diet-conscious woman didn't fit the profile of someone at risk for heart disease or stroke.
They just didn't think it could happen to somebody, my age, my profile. But it's made a lot of them aware, I believe.
It turns out Marge is a borderline diabetic and had some blood pressure issues too. Now, 3 new studies suggest there are clues doctors may be missing that could indicate a patient like Marge is heading for trouble. According to researchers, those clues can be found in mammograms, blood sugar tests, and common daytime dosing.
It would seem that those 3 different findings would have nothing to do with each other, but in fact, all these are describing things that have an association with heart disease or stroke.
In the first study, researchers looked at the mammograms of 200 stroke patients and found calcium deposits in breast tissue in 56% of them. The bottom line, women with artery buildup in their mammograms had a greater risk for heart disease and stroke.
The radiologists typically don't report that because it's so-called a benign finding as far as breast cancer, but it may be a very significant finding for women who have early heart disease.
A second study found a link to stroke in blood sugar tests. 1,700 patients in their mid-60s were measured for blood sugar and insulin levels after fasting. Those with higher scores had twice the risk of stroke over the next 7 years compared to those with lower scores. And a third study documented the daytime dosing patterns of 2,000 people in their mid-70s. Researchers found the odds of having a stroke were nearly 5 times greater among heavy dosers compared to those who rarely nodded off. Doctors say the heavy dosers likely suffered from sleep apnea or other sleep disorders that triggered dangerous fluctuations in their blood pressure.
I think what they're trying to do over here is focus on the stroke risk and the fact that some simple things that are out there we're sort of glossing over, and maybe we should be paying more attention to these things.
The blood sugar test used in the study, called a homeostasis model assessment, or HOMA, measures a ratio of blood sugar and insulin levels. High scores can indicate a patient is borderline diabetic. Diabetes is one of the risk factors for heart disease and stroke. As for the mammogram findings, doctors say it won't hurt to find out if calcifications are present in your screenings and to have a conversation with your doctor about what it may mean in your case. Still no solution for a terrifying condition called anesthesia awareness.